Recent advancements in stem cell research have led to significant breakthroughs across various medical fields. For instance, researchers at the Murdoch Children's Research Institute in Melbourne are developing stem cell therapies to treat heart failure in children. By reprogramming specialized cells into immature stem cells and then into heart cells, they create heart organoids that can be injected into failing hearts. Animal studies have shown promising results, and human clinical trials are forthcoming. In addition, the Murdoch Children's Research Institute successfully created lab-grown blood stem cells that closely resemble those in the human body. This innovation could revolutionize bone marrow transplants for children with blood disorders, such as leukemia, especially for those with outmatched donors. Clinical trials are anticipated to begin within 5 years. Just this year, a 25-year-old woman in Tianjin, China, appears to have been cured of a type 1 diabetes following a groundbreaking stem cell transplant. Her own cells were converted into stem cells and transplanted into her abdominal muscles to grow insulin-producing islets. Within 3 months, her blood sugar levels were naturally regulated without the need for insulin injections. At Melbourne's Fleury Institute, researchers have developed a method to test treatments for motor neuron disease using stem cells from patients. By modeling these cells on motor neurons and inducing the disease, they can rapidly and accurately test new drugs, potentially accelerating the introduction of viable treatments. Scientists have developed embryo models from stem cells that mimic human embryos at about 14 days of development without using eggs, sperm, or a womb. These models could revolutionize our understanding of early human development, providing insights into miscarriages and developmental disorders. However, their creation raises significant ethical questions. The stem cell industry is poised for significant growth, with companies like Mesoblast Lellard and Capricor Therapeutics Inc. seeking FDA approvals for their therapies. A more favorable regulatory environment and supportive health policies could further propel the sector forward. Stem cells are categorized based on their origin and potential to differentiate into various cell types. Here's an overview of the different types. Embryonic stem cells are derived from the inner cell mass of a blastocyst, an early-stage embryo. They are pluripotent and can differentiate into almost all cell types in the body. They can be used in research into early development, regenerative medicine, and drug testing. Their use involves the destruction of embryos, raising ethical issues. Adult stem cells or somatic stem cells are found in specific tissues, for example, bone marrow, skin, brain, and liver. They are multipotent and can differentiate into a limited range of cell types related to their tissue of origin. Examples include hematopoietic stem cells that produce blood cells and mesenchymal stem cells that are found in bone marrow and can become bone, cartilage, or fat cells. They are used for bone marrow transplants, tissue repair, and treatment of blood-related diseases. Induced pluripotent stem cells are adult cells reprogrammed to behave like embryonic stem cells. They can be used for personalized medicine, drug testing, and disease modeling. They can be created from a patient's own cells, ensuring genetic compatibility. This reduces the risk of immune rejection in transplantation therapies. Scientists can study disease mechanisms in a lab setting, testing drugs and treatments on cells that mimic the patient's disease. Perinatal stem cells are found in umbilical cord blood, placenta, and amniotic fluid. They can be saved for future medical treatments and treating blood and immune system disorders. Cancer stem cells are found within tumors or hematological cancers. They can give rise to all cell types in a tumor. They are critical for understanding tumor growth, metastasis, and resistance to therapy. Totipotent stem cells are early embryonic cells, including the zygote and first few cell divisions. They can form all cell types, including embryonic and extraembryonic tissues. They are used primarily for research. Amniotic fluid stem cells come from amniotic fluid collected during pregnancy. They can differentiate into various cell types. They can be used for research and potential treatments for congenital disorders. Neural stem cells are found in the brain and spinal cord. They can differentiate into neurons, astrocytes, and oligodendrocytes. They are used for potential therapies for neurodegenerative diseases such as Parkinson's and Alzheimer's. These developments highlight the expanding potential of stem cell therapies in treating a range of conditions, offering hope for more effective and personalized medical treatments in the near future.